Hi, Gibson, Steve Nicholls coming to you from ESC 2023. We're talking about the clear outcomes study and the total event analysis. Usually we look at the time to first event, but people with atherosclerosis, they're frequent flyers. They have a lot of second and third and fourth events. So, Steve, you looked at this analysis. Talk to us a little bit about what happened.
So clear outcomes, 14,000 patient study, high cardiovascular risk, high LDL cholesterol, but importantly, everybody was statin intolerant. And what we reported at the ACC with the primary analysis was that treatment with bempedoic acid, an oral LDL cholesterol lowering agent that appears to have no muscle type issues that we see with statins, lowered the 4-point primary endpoint MACE composite by 13%. But we were interested in looking at total events. And we know that these patients are not just at risk of having one event in the future, but in fact are at risk of having multiple events kind of moving forward. In fact, the patient who had the single greatest number of events in this study on an average of 3.5 years of follow-up was 11.
Oh my
So it
gosh.
tells you that
Wow.
there are people who are really frequent flyers
Mm.
in our coronary care units and our cath labs, and we need better solutions. So what we observed was, in fact, the hazard ratio for 4-point MACE was 0.85, 0.83. Sorry, actually, can I say that again? Sorry.
Sure.
Yeah. What we observed was the hazard ratio for the primary endpoint was now 0.83, with a hazard ratio for the key secondary endpoint of cardiovascular death, MI, and stroke of zero point 0.8. So,
Wow.
in fact, and when you looked at the study, when you looked at patients according to increasing number of clinical events that they experienced, the hazard ratio progressively decreased. So what that suggests to us that in the higher risk patients in this study, they would appear to have derived potentially greater benefit from lipid lowering with an effective agent. In this case, it was bempedoic acid.
Every lipid lowering trial I've been involved with, every antiplatelet trial I've been involved with, the multiple event analysis always turns out to be more statistically powerful with a greater event reduction than the primary analysis. You talked about the relative reductions, about a 20% relative risk reduction. How did you do in terms of absolute risk reduction?
So what that kind of constitutes to is a reduction in the total number of events in this study that we would have produced per 1,000 patients, a reduction in 66 kind of additional events by treatment with bempedoic acid. So what we see is that constitutes to a greater absolute risk reduction, and therefore a smaller number needed to treat. And we've seen that in, again, as you've said, in multiple studies. We see that not only if we look at the total events analyses, but if you look at, say, for example, the Fourier analyses with PCSK9 inhibitors, if you identify the higher risk patients, multi-vessel disease, recurrent disease, you tend to see a greater absolute risk reduction and therefore a smaller number needed to treat. So our ability to identify really the highest risk patients really gives us the first foray into who we should be selectively targeting these new therapies towards.
Great. Well, Steve, thank you. Great data, great result. And thanks for joining us today. Thanks to all of you for joining us here from ESC 2023.